This panel will be moderated by Dr. Matthew Smith, who is the co-director of the Center for Population Health and Aging and associate professor at Texas A&M University, in addition to being an esteemed member of the Foundation's Scientific Advisory Council. Our panelists today include Maureen Feldman, Director of the Social Isolation and Impact Project at the Motion Picture and Television Fund, Sandra Harris, State President of AARP Massachusetts, and founder and co-chair of the Massachusetts Taskforce to End Loneliness and Build Community, and Dr. Emily Ann Vall, Executive Director of Resilient Georgia. This session will also have a brief audience Q&A, so please submit any questions for the panelists in the chat. Welcome all, and I will turn it over to you, Matthew.
Fantastic. Thank you so very much for that introduction. And I'm so excited to be able to moderate this amazing session. And thank you already to everybody. I think that we all know with the added attention that is being given to social isolation and loneliness, there are so many new synergies, so many new coalitions, task forces, action alliances that are springing up in states and regions, but more local as well. So those opportunities to bring together multiple partners, that's what we're going to talk about. And we're going to hear from Maureen and Emily and Sandra. I can't wait to get started. Welcome and thank you. I'd like to go ahead and pose the first question. Could each of you, and I'll start in that order, Maureen, Emily, and Sandra, could each of you please provide the audience with a really brief 2-minute overview of your coalition, what it is, who's in it, and some of your major primary goals and objectives?
Great. Well, good morning. Thank you for having me, and thank you for moderating, Matthew. So the Motion Picture and Television Fund has been committed to, addressing community needs for a long time. People think we're just about the industry, but we actually are a pretty active community partner. We formed the coalition in 2017 after we hosted a summit on social isolation and loneliness. And there was so much interest. People were so, I guess, invigorated by this conversation. We decided to keep it going. And that's pretty much how it started. I thought 4, 5, 6 organizations would show up. 23 organizations showed up to the first meeting that we had. And so we knew we were onto something. We meet quarterly, we have a summit yearly, except for COVID year. And we focus on best practices, sharing new research, up-to-date information, and forming partnerships and collaborations. And that, I think, is one of the keys to our success and for going on for so long. Some of our best successes to date really have been that some of the coalition members, in fact, the majority, are starting to add social isolation and loneliness screeners into their intakes. Even if it's just one question, we're starting to make social isolation and loneliness and social connectivity a priority to find out if that is going on with the clients or the groups, the individuals, whoever patients the coalition members are serving. Some of our goals are really to standardize the measurements on how we find out about social isolation and loneliness. We want to use the same tools so that we can move towards a standardized way of evaluating our impact and our successes as a coalition. So that's kind of it in a nutshell. Some of the organizations are working with local police officers, training them how to identify social isolation and loneliness in some of our homeless population. We're working with legal services who address older adults, teaching the young lawyers how to identify social isolation and loneliness. And I'm most proud of, we're recently including the IDD community, who has pretty much been left out. So we're starting to work with those organizations to provide some programming to keep those individuals engaged, especially during COVID.
Thank you so much, Maureen. Emily, could you please tell us a bit about Resilient Georgia?
Absolutely, and thank you for having me. So Resilient Georgia, we're a 2-year-old 501c3. We were born in April of 2019, and our end goal is to create an integrated behavioral health care system, and we intend to do that by making everyone in Georgia both trauma-informed and resilient. So really thinking about how to be proactive rather than reactive, and working to be upstream rather than waiting until, folks are in the ER with severe mental health issues and in need of, high intensity care. We currently have over 700 stakeholders at the table. So that includes private and public partners, and very much appreciate the previous conversation about physical activity. Our board chair is Dr. Brenda Fitzgerald, and we were both at the Department of Public Health together. She's the former CDC director and former commissioner in Georgia. So we both bring a public health lens to the work as well. So we've been pretty successful in getting a lot of the public folks to the table that may not have been there in the past. And then we also have our two founders are from the philanthropic community. So we've been very successful in getting those voices to the table, because we've found, especially with COVID and COVID response, they're just, they definitely need to be there. So like I said, we have over 700 stakeholders at the table, and what we've done in order to engage the whole state and all the diverse areas of our state is to create different regional coalitions. So right now we have 12 regional coalitions. By the end of 2021, we hope to have 16, and they're basically charged with the same mission. So they're asked to invite private public partners from all walks of life to the table, whether that's, students, trusted messengers, legislators, et cetera. And they create an action plan together. So every region's action plans look very different. They all have short and long-term SMART goals. And they're all really working on resiliency, mental health, behavioral health, and trauma-informed care.
Thank you so much for that. Fascinating. Sandra, can you please tell us a bit about the Massachusetts Task Force to End Loneliness and Build Community?
Absolutely, Matthew. It's my honor to be here, and thank you for the invite. We are a coalition of 30 partner organizations and thought leaders who've come together. We've moved out of our silos and are using our collective resources to reimagine how we can provide that collective impact we heard from the previous sessions today. We are cross-sector collaboration, including state and local governments, agencies, nonprofits, councils on aging, senior centers, colleges and universities, community leaders, healthcare providers, media, and working with under the guidance of the AARP Foundation. Our goal is to ensure that all Bay Staters feel connected to the community and enjoy a sense of social well-being. Ours is a grassroots approach that began in September of 2019. In spring and early summer 2020, we held 4 regional conversations to really gain an understanding of how this epidemic was being manifested in our state. What were the challenges? What were the issues that perhaps had policy implications? Were there things that they were doing that were working and making a difference? On Good Neighbors Day in 2020, we held our first statewide summit where we presented our findings and goals for 2021. And based on those findings in our community conversations, we set 3 major goals. One was to raise awareness of the health benefits of connections and the health risk of loneliness and social isolation. Number 2 was to develop strategies to bridge the digital divide. And lastly, to promote the value of including all generations and addressing loneliness and social isolation.
Outstanding. It is so fascinating to learn more about all of your great efforts. And as everyone can hear, these 3 different initiatives are quite different and have all been relatively new in some ways, but have been evolving as the pandemic has occurred and has been kind of evolving. So with that said, when thinking back to the beginning, for all of those who maybe don't have coalitions or thinking about starting coalitions, you all are quite mature, as you can see in terms of your partnerships. How can you tell any of our attendees about how the coalition developed? What was the driving force behind it? And how did you actually get it started? And maybe we can start with Emily on this one.
Sure. So ours is a little bit different. Our story started with our 2 founders. Like I said, they're from the philanthropic community, and their lens, as you can imagine, is different. Like Sandra said, they saw the need for a backbone organization framed in collective impact to come to the table because they were getting a lot of asks that were either duplicative in nature, they weren't aligned with what other folks around the state were doing, or they were siloed in different ways. So they spent thousands of hours interviewing different partners and just getting insight on what their partners and their stakeholders felt that they needed. And so that's kind of where they came up with the idea for Resilient Georgia. I walked into this space, like I said, with thousands of hours of interviews already done. So a lot of our partners were already at the table, rearing to go when we officially became a 501c3. Since then, we have done an incredible amount of outreach to get folks at the local level really engaged in different ways. And so that's been a very exciting journey. We've been working with all of the, like I said, shared messengers in these different areas of the state. Like many of you, our state is very diverse, whereas we have a huge metro epicenter of our state, and then we have very, very rural areas. And so it's really, we've tried to create learning communities in all of our different regions so everyone can really learn from each other, connect, convene, and build and bolster their coalitions that way. And then we kind of serve as the statewide coalition. So all of the different regions are talking kind of like a hub and spoke model to us, and we sit at the center and get all of the information out.
Sandra, would you like to go next? Tell us how the coalition, your task force got started.
Sure, very similar to Emily. We were having people coming in and asking, begging for solutions and help with finding solutions. We found this especially true with our age-friendly, livable communities who had included addressing loneliness and social isolation as part of their action plan. We were quite fortunate to have working relationships with Dr. Caitlin Hoyle, who is a researcher at the UMass Boston Gerontology Institute. Caitlin had already spent a lot of time in the communities working, especially with our age-friendly communities. And not only was she and her team ready, not only did they have understand the issues, they were ready to mobilize. So the first thing that we did was to call all of the partners that we knew who were already working in this space. We called them around the table and said, Houston, there's a problem, and how do we come together to address it? So from a small group, I guess the initial founders, I call them, of about 9 or 10 organizations, we've now grown to 30.
Outstanding. Thank you for that. And Maureen, please talk.
Yeah, mine is a little bit different with our organization. I personally was very interested in this. I had been researching and writing papers. I teach older adults how to use technology, and specifically on how to stay connected, because I saw many of them being left behind, basically, and not being able to socialize the way they usually do. And in my position at the Motion Picture Television Fund, we were lucky enough to be working with the AARP Foundation, wonderful team there, who we applied for and received a grant to set up a program, a strong, robust social call program, reaching the most isolated older adults who were not, using technology. And through that, we decided to invite some of our community partners to a summit just to talk about and basically, share what we were learning so that we could be strong community partners. And through that, our goal was really to inspire and educate other organizations based on the information we had been learning so that they too could launch programs. And what we didn't know was how many people were really interested in this. So ours was really grassroots. I reached out to my network, my colleagues, my Dr. Scott Kaiser, who I worked with. We just invited everyone we knew to the table. We didn't leave anyone behind. And through that, we invited anyone that wanted to participate, that served any community, really. It leaned more towards older adults. And through that, we took surveys and asked the group, what can we provide you most? And hands down, over 80% said we need best practices, we need up-to-date research, we need inspiration and guidance. So we focused on helping them form collaborations and partnerships. And again, we've hosted these summits where we've invited thought leaders to come in and teach us and guide us, and we're continuing to do that. And now we're gaining some momentum and strength and working together, which is really, I think, the most powerful way to make a difference.
I couldn't agree more. And I appreciate you all three sharing your experience and your journey, because naturally this all comes from recognizing need and banding together partners. And Maureen, you started to touch on it a bit when saying that you invited everybody to come to the table. We've seen from the different three of you organizations that Sandra, there's about 20 organizations involved at current with different types of networks, and Emily referenced about 700 different representatives or members. So very diverse. My question to all of you would be, how did you really decide who to invite to the table? How did you get started? Was there anybody that you intentionally left out at the beginning stages? Are there any sectors that are missing? And how has it been working with each of those different sectors, especially the state or the local health departments? So maybe who to start with this time? Let's go, maybe Sandra, could you start?
Sure. The first thing that we did was try to understand who were the organizations and people who are already in the space. And we had a very open mind concept. We came in with the idea that we don't know what the problems are. We don't know we don't really understand the problems. We don't know what the solutions are. And it's going to take all of us to make a difference. Then we began to ask them who do you know in this space who needs to be around the table? And people continue to come to the table. Very much like Maureen's, is a very open coalition, and people are invited to attend our meetings. They're invited to join us in any way that we can, because we realize that it's going to take everyone to solve this problem. So that's the way we handle it. And what was the second question, Matt? I'm sorry.
Just if there are any other sectors that are not necessarily represented who should be, and how your engagement with the state and local health departments has been.
Well, we do have the Massachusetts Department of Health is a member of our coalition, and we work through the individual organizations, especially our age-friendly communities, and getting the local health departments involved. And we know that we still have a lot of work to do that. One sector that we really would like to bring to the table are medical educators, and really beginning to work with them to begin including loneliness and social isolation and addressing that as part of the curriculum for students who are going into the medical fields, because we do feel that we need more assistance on that level, as witnessed by the report that was commissioned by the AARP Foundation to the academies.
I love that, especially the next generation. We need to nurture them and give them the skills and connections they need.
Yeah.
To be able to be
Absolutely.
Emily, can we turn to you about who you invited? How did you get started? Is there anyone missing? And how are you working and engaging the various sectors?
Absolutely. So when we got started, we had about 40 partners at the table. And a lot of them were in the medical community or healthcare providers, which are a very important voice in this work. So they helped us develop our strategic plan, those kind of core partners, because we realized, 700 people in a room is not going to be helpful when creating a strategic map. So we started out with about 40 heavily medically facing, and then we grew from there. We did do in the first year an awful lot of outreach with community-led organizations and trying to get those trusted messengers and community members to the table to provide insight. We purposely did not enter the advocacy ring right at the beginning, because the last several years, so many different things have been politicized, and we wanted to kind of figure out our footing before we started really talking to legislators heavily and putting words behind our work in terms of legislation and so forth. So we purposely steered away from that. Now, however, we are starting work there. So we're working more and more with legislators, with stakeholders that help drive policy. And then with regards to public health, like I said, we bring a lot of public health lens to the table. However, the actual department for the first year of COVID, they were just so underwater. So we allowed grace, and now we have a very strong working relationship with them now that everybody's got their feet under them, and COVID is by no means under control, but at least at the State Department and local departments, they're starting to get in a rhythm. And they recently received a large CDC grant, a data to action grant that we're working closely on. So we have a great relationship with public health now, we're happy to say.
That is wonderful. And Emily, ever so very quickly, are you able to work in all counties in Georgia?
Right now we are in 97, and our state is very odd. Those of you that aren't Georgians, we have 182 counties, I think right now, or 159 counties, 182 school districts. So we're in 97. By the end of the year, we will be in 120.
Wonderful. Thank you for that. That was a direct question posed, but Maureen, please tell us.
Yes. So Los Angeles is such a large geographical area, and has a lot of initiatives. So we knew just launching a program, we had to be a little strategic. So at the beginning, like I said, it was very grassroots. We invited our networks, people that had reached out, and then we asked each one of those individuals who needs to be at the table. Who do you know that should be here also? And then we did a little work. We started some partnerships. People actually took actions that we could report on to demonstrate that the coalition and being a member of the coalition had some value. And that's when we started to reach out to government officials. We reached out to the Department of Aging and the Los Angeles Alliance for Community Health and Aging, Department of Women's Health, the Department of African American women, and across the board. And slowly representatives from those agencies, Department of Mental Health, Department of Public Health, started to attend and recognize we were onto something. And that's when I think we started to really gain momentum. We had support of government agencies. We were able to cross-promote our meetings and our activities through these other organizations. But one thing we did do is we did limit who was at the table. We asked that only decision makers attend. We couldn't host a meeting with 700 people or even 200 people. The cost, there was no funding for this at the beginning. So we really asked, if you're coming to the table, we want you to be able to commit that your agency or your organization can actually take steps. And that really elevated the conversation. We had leaders, organizational leaders, and people who represented, government offices attending. And I think that helped us. We invite everyone to the summits and interns and, new hires. So we like to distribute the information and help support everyone. But when we have our meetings, we keep it very focused to people who can actually make decisions. And so for us, that's helped. And then now, of course, with having government support, we're able to do more and have stronger collaborations.
Outstanding. And the insights that you all are providing are so valuable. And I hope everybody who's thinking about starting or joining one of these efforts, whether it be a coalition, action alliance, task force, call it what you need, but basically banding together interested parties with a like focus. I hope these gems are being collected and noticed. We have a few questions that have been coming from the audience, and I think with the time remaining, we should maybe turn to some of those. The first one is ever so practical, and it comes, from somebody in Tennessee that says, I see myself as a little fish in a big pond from Tennessee, even though I have many friends and can do many things, but what's the real first step? If you want to start this, is there a certain organization, an entity? Who should be the one who kicks this off? Who should they go to? What should they do? Step one. Maureen, maybe start with you this time. And then
I would like to answer that one, because whoever asked that question, you are the person. You have to, someone has to just take ownership of it and decide this doesn't exist. If I go and ask people, it will get kicked around longer. So just start something. If you invite friends over to your house for a Friday night conversation, if it's coworkers, talk about it, write down some goals or bullet points, visualize what you'd like it to be, and then back into who needs to be there, who can support you. And No, most people are not interested in helping and supporting ideas. So once you do something, people will see there's energy there and they will start supporting you. But I have to say, whoever asked that question, go for it.
Absolutely. And I would
By the way, this coalition is amazing as well. So much support, so many resources. Learn, talk to Eddie Garcia, or Jillian, and get involved, because you will gain so much information, and that kind of support you can't find anywhere else.
I couldn't agree more. Emily, Sandra, anything to add there before the next question?
Well, I would like to suggest that people contact, especially if they have age-friendly, livable communities and directors, to start there. And lastly, I would strongly recommend that everybody finds their Caitlin Coyle, because there's always someone on a university level who is committed to this issue, is doing research in this issue, and is ready to help mobilize.
Yeah.
And I'll just add one quick resource to start small that we've been using in our different communities and with lots of our partners. I don't know if any of you have heard of civic dinners. They're now called inclusive, but I just put the link in the chat. And it's a framework where this organization helps create a dinner where you can invite stakeholders to talk about a specific topic. It can be a virtual dinner or in person, and it really gets content and connectedness out, and it's an easy first step.
Wonderful resources. And I love it, because who better to ask than you three? So with that said, here's another question that came up that we would love to be able to do. And there's another question that actually just came up about how to fund coalitions. Naturally, banding together people can be very effective in their own rights, but where do you find the funding? How do you synergize and start to activate these initiatives around those funds?
I wish I could answer that, because we're looking for funding as well. We have gotten some funding from our local, our AARP Massachusetts chapter, that's really helping us to kind of look at the research and the work that Caitlin is doing. But at this point, we have had to depend with great pride on the goodness of volunteers, and volunteers from organizations that are making the difference. And so that's how we've gotten started. And it's amazing how much the momentum that we've gained with volunteers who have, in most cases, full-time jobs, but who are committed to this issue and solving this issue in our community.
I'll jump in too and say, we did not have funding to start this coalition. I did a lot of it on my own at the beginning. It was part of my job to be launching a program, and I thought, why not share what I'm learning? Hosting a meeting was not an expensive endeavor. And so, until you actually start trying to launch programs, citywide or countywide, the cost is really about getting together and supporting one another. So there isn't a lot of cost to do that. So I wouldn't let funding be the barrier to getting started. We too are looking for funding. We collaborate, we have volunteers, there are interns at the universities who want to get involved. So there are ways, again, if the idea is great, people come to the table and they are very generous with their spirit. And when we're starting something new like this, you sometimes have to rely on the kindness of those volunteers. And the goal is to grow to where we can be much more inclusive. And then I would think funding could come from local governments and other organizations who want to see this happen. But don't let, again, funding be your barrier. Just get together and you'd be surprised, like Stone Soup. For those of you who know that book.
Absolutely. And I will join in the party and say we too are looking for funding. However, I will say one thing that has been very effective for us is I constantly have small and large proposals in my back pocket. And we've been shopping those around. So whenever, somebody is interested, I immediately have something to share. And in the recent last few weeks, specifically with all of the, American response dollars starting to come down and all of the additional dollars coming down at the state and local level, we've had a lot of folks interested, and I just saw before I logged on, we got another grant awarded that I was not at all expecting, because I think, and I think a lot of people are going to be ready to hand out money to those that are ready to spend it. It's just more money than any of us have ever seen. And I think if you're ready with a plan, then you may very well be a quick recipient.
Can I just add, Matthew, that exactly what Emily said, for you smaller organizations that want to do something, being part of a coalition, you're learning, how to do it in a strategic way, so that when those grant opportunities are available, you can prove that you're ready. So you do strategize and have your game plan, and then start looking for those small micro grants or opportunities to get funded.
And I would just like to add that, getting started does not mean starting from ground zero. There's lots of good programs and ideas that are out there to learn from, to share. And we live by the mantra, it's okay to beg, borrow, or steal, because forgiveness awaits us on the other side.
Yes, yes.
Absolutely. Well, our time is wrapping up, so I really want to be able to thank Maureen, Sandra, Emily, thank you so very much for sharing your insights, your enthusiasm, your successes, and giving those practical recommendations for individuals who want to synergize their communities, want to mobilize, want to make a difference. So thank you so much for these invaluable insights. There has been so much activity in the chat, so resources and links and things that have been being shared. So just lots of resources and lots of opportunities. And I know that more and more questions could go and go and go, but this is our time. Thank you all three so very much for all you're doing and sharing your time today.